3 weeks ago, the COVID inquiry began, an independent and public examination of the way the UK dealt with coronavirus. It's being led by Baroness Hallett, a retired Court of Appeal judge, and this stage is looking very specifically at how prepared the country was to deal with a public health crisis of this magnitude. So far, we've heard from the former Prime Minister David Cameron, former Chancellor George Osborne, and the Chief Medical Officer Sir Chris Whitty. On Tuesday, however, it was the turn of the former Health Secretary, Matt Hancock.
I am profoundly sorry for the impact that had. I'm profoundly sorry for each death that has occurred. And I also understand why, for some, it will be hard to take that apology from me. I understand that. I get it. But it is honest and heartfelt. And I'm not very good at talking about my emotions and how I feel. But that is honest and true.
Now, that very public statement of contrition was met with anger in private from some of the families of those who lost their lives, of which more later. But at its core, Mr Hancock's testimony made clear that he feels the government's response, the pandemic doctrine they chose to follow, was flawed from the off. I'm Niall Paterson. Welcome to the Sky News Daily. Now, whilst the politicians are fond of saying that they were on the front line of the response to COVID, in reality, it was, of course, the care workers, the hospital ancillary staff, the nurses and the doctors. Later, I'll be speaking to the man who was chair of the British Medical Association during the pandemic.
It's absolutely the moral right thing to do, to have an inquiry that is properly objective and that gets to the bottom of how the UK responded to what has been the greatest public health crisis since the inception of the NHS. Let's not forget that more than 200,000 of our citizens lost their lives, which is the highest in the whole of Western Europe.
But we begin with Sky's health correspondent Ashish Joshi speaking to us from the inquiry itself.
So this is going to be a wide-ranging public inquiry, most importantly, to learn lessons to make this country as safe and as secure as it can be for future pandemics.
We're hearing from a pretty impressive cast list already. David Cameron, George Osborne, Chris Whitty cropping up. We've been hearing from the Health Secretary for large parts, of course, of that period, Matt Hancock. And according to him, when asked, were we prepared enough for this pandemic, he was apparently informed way back when that this country was the best prepared in the world. Didn't turn out that.
To be fair to Matt Hancock, he did say it didn't turn out like that. His line of defence was to say, I inherited a system that was flawed. He kept using the word doctrinal. What he was trying to say, Neil, is that there are so many things wrong within the health system in this country which does not equip it for a fast-moving pandemic. He said we were not prepared to scale up testing. Our diagnostics wasn't capable. We were just not in a position to deal with a pandemic because we were too heavily focused not on stopping the spread of COVID-19, but we were too focused on dealing with the fallout. What do we do with mass casualties and their hundreds of thousands? What do we do when our hospitals are overrun? So in other words, we're looking at the tail end of the pandemic once it struck, and not with how do we stop people becoming infected? How do we stop the spread of any disease or any infection? So he said that's why we were not in a position to deal with a pandemic effectively. Matt Hancock kept saying all the way through, I tried to do the best I can, but it's an inherently flawed system. And he was asked by Hugo Keith KC, the COVID inquiry lawyer, the lead counsel, again and again and again, remind us, Mr. Hancock, who do you work for? Yes, it's the Department of Health. Remind us, Mr. Hancock, what is your title? Secretary of State for Health. Therefore, ergo, why did you not do something about it before the pandemic hit? And we didn't actually get the answer, the definitive answer.
I mean, it's interesting when you were referring to Matt Hancock's answers today, you used the phrase line of defence, because in essence, that is exactly what it is, isn't it? Matt Hancock making the case that Matt Hancock wasn't wrong. But as you say, he identifies these problems with pandemic preparedness. He also took the job in July 2018. If he was aware of this, could not something have been done? And as you say, on that point, I didn't hear very much by the way of counter-argument by Mr. Hancock.
I've been speaking to the bereaved families who are here, and this is why they're furious with him. They said he came here with this line of defense, and then he elected to promote all the good things he did during the pandemic. He said, he didn't listen to the World Health Organization's advice. He imposed quarantine on air travelers arriving from countries where COVID-19 was spreading. It was him who instigated the vaccine procurement. So it's all about the things Matt Hancock did right, despite this flawed health system.
We did get a recognition from Matt Hancock that the pandemic plan that they were using was ultimately dated all the way back to 2011. We also got an acceptance that no-deal planning for Brexit within the Department of Health actually had an effect on our ability to deal with the pandemic.
This is Module 1. Module 1 deals with the years leading up to 2020, and it is, I think, accepted fact now from all of the witnesses who have come, including Sir Professor Chris Whitty and Sir Patrick Vallance, that pandemic planning certainly was impacted by Brexit. And that's because they wanted to make sure, the government wanted to make sure that it was fully focused on Brexit, the supply lines, the availability of medicine and everything else.
Just in terms, though, of this argument that Matt Hancock is making about pandemic doctrine, the idea that we were far too focused on dealing with a pandemic rather than preventing a pandemic. I mean, he is right, isn't he? I mean, he is absolutely correct, isn't he, to identify that perhaps we were not as quick into lockdown because we weren't ready to move into lockdown, as many of the medical professionals were telling us we should have been doing.
Yes, David Cameron, the former Prime Minister, said that he'd been sounding warnings as early as 2016 because that's what he had been advised by his own health professionals. So therefore, health professionals, including the World Health Organization and our own experts here in this country, would have been aware that pandemics, global health emergencies come in cycles, and that there should have been effective planning for any such emergency. But what has transpired over the past weeks of evidence here, listening to the experts, all of that planning and preparedness was focused much too heavily on influenza and an influenza pandemic, and that we were told that's because that is what's happened in the past, and you just can't predict COVID-19.
Did you detect any contrition on the part of Matt Hancock? I mean, the reason I ask, Ashish, is we should not forget this was a health secretary who was forced out of his post in utter disgrace. I did hear him say, I am profoundly sorry for the huge error in doctrine, but that's not him apologising for his actions. That's him saying, others made incorrect decisions. I had to respond. This one's not on me, Gov.
Absolutely spot on. And that came across loud and clear to the bereaved families. They were here to see Matt Hancock when he arrived this morning, holding photographs and pictures of their deceased loved ones. He apologized and he said, and I know that they will find that especially difficult to hear from me in particular. So he knows that he has got to go some way to build any bridges with the bereaved families who are here. But not only did he apologize in the hearing on the public record, and they couldn't do anything, they couldn't react to that apology during the hearing. After the hearing was over, Matt Hancock went into a room where the bereaved families were gathered. He went in there to apologize. I spoke to one of these bereaved family members, and she said, we were shocked. We could not believe he had come over to speak to us.
Hancock approached us, and I weren't having any of it. I was like, no, don't you even think about it. And I turned my back on him. And he was looking for forgiveness. But I said, you'll be forever looking for forgiveness because you're not going to get it off the bereaved.
They all turned their backs on him and they refused to accept his apology. And I think one of the bereaved family members even swore at him. Certainly there was not an altercation, but there was a very strong exchange. If Matt Hancock was in any doubt that his evidence today was not what they wanted to hear, they wanted to hear a minister explain things went wrong, I could have perhaps listened to advisors, put in place some measures to protect more people. They didn't hear that, and they did not accept his apology.
A complaint that has long been made of this COVID inquiry is that it simply isn't giving enough attention to the views of the families of those who lost their lives. The medical profession had those suffering from COVID at the heart of everything they did during those COVID years. Shouldn't the inquiry be doing exactly the same? Dr Chaand Nagpaul was chairman of the BMA Council from 2017 to 2022 and thus represented the medical profession during the COVID pandemic.
I think it's really important to hear the real experiences of those who were affected. Sadly, we cannot hear from those who have passed away, but we can hear the experiences of those close to them. We can hear the experiences of the issues they faced, the limitations in the way in which the nation may not have been able to protect them. And I can tell you, as a doctor, I'm a GP, and I recall very, very clearly when in March we were seeing every single day notifications of deaths in a way I had never seen before in my life as a GP. I've been a GP for 3 decades. And what was also striking for me was how many of those names of people who had died were of ethnic minority origin, because I practice in North London. And there were issues like that that really highlighted at its heart how we were not protecting people. We were looking after care homes where we had residents who were getting infected, many of them sadly not surviving.
Talk to me about those lessons, Doctor, that you feel have already been learned. Much of this stage of the inquiry is focusing on preparedness, or frankly, the lack thereof, not just in central government, but within the health service itself. I mean, just take us back to those early days and the lessons that you yourself learned. I mean, it must have felt fairly chaotic.
Well, first of all, I remember doing interviews at the time in December 2019, January 2020. So this is before COVID hit our shores. And I remember, the fact that we had an NHS that was already in crisis. We had about 10,000 doctor vacancies, about 100,000 vacancies across the NHS. We had record waits in terms of ambulance response times. We had record waits for cancer treatment months before COVID hit us. So we didn't have an NHS that was able to cope with even a surge of normal winter pressures, let alone a pandemic. And I think one of the key lessons is that we can no longer as a nation, or we should no longer as a nation, accept a health service that runs each year on a deficit of infrastructure, of people and hospital beds and community facilities, such as in general practice. And we were not, therefore, prepared in terms of infrastructure. The second, of course, when you have any sort of infection, a pandemic in particular, you need to be prepared for this widespread infection that literally takes over a whole nation. The other part about any pandemic is you need to control a spread of infection. And again, we didn't have the testing capacity. And one of the reasons we didn't have the testing capacity is that not only did we not have enough hospital beds, enough GP facilities, enough staff, we also had run down our public health infrastructure, which had actually had cuts of around £400 million in the previous decade. Now, the other thing the government didn't do was recognise, sadly, that when you have any sort of pandemic, it will not affect everyone equally.
I mean, Dr Nagpaul, am I wrong to detect perhaps just a touch of frustration in your voice there, that there was empirical evidence about what was happening within ethnic minority communities here in this country that the government either didn't pay enough attention to or ignored?
Yes, there is frustration. It baffles me because I would have thought that the protecting the nation, protecting its citizens, protecting those that care for others should have been not just a moral responsibility, but it is the responsibility of government to look after its people. And I couldn't fathom out why there was this tardiness. And in fact, I think that that looking back, this is something that should never be repeated. This is one of the key lessons that should never be repeated.
Listening to the former Health Secretary, Matt Hancock, giving evidence to the inquiry, we at least have a slightly clearer picture of his take on what went on in the run-up to 2019-2020. And in his mind, he arrived at the Department of Health and was told, we are the best prepared in the world for pandemics. He then went on to say he discovered subsequently that that was not the case. It is understandable that you feel frustrated. I wonder if you and your colleagues might also feel pretty angry, given that it was you that was out there on the front line dealing with patients during the midst of this pandemic, and none of the work which could have been done in the 5 years leading up to it had been.
I think the inquiry will, I hope, be able to demonstrate whether this was actually all down to a lack of planning, or was it a lack of implementing some of the key messages from those pandemic plans. Look, I can't speak for Matt Hancock, who was Secretary of State at the time. All I can say is that the government ultimately had a responsibility to take the right action in the earlier stages of the pandemic. In fact, don't forget that we in the UK had advanced knowledge. We saw what was going on in Spain and Italy, and therefore we had a head start in being able to know what needed to happen. And in spite of that, when we actually saw COVID hit our shores, it felt like we didn't know how to address it. We were told that we had the facilities to contain the virus, but unfortunately, we realized that the reality was far removed from those original assurances. So there were these incongruities of the UK's approach to containing the virus in the early stages. But in fact, if the reason was because we didn't have the facilities, because we didn't have the stockpiles, then I think it would have been important to have been honest with the nation about those limitations.
Thank you, Doctor. Now, quickly back to you, Ashish. And look, this inquiry is going to take years to conclude. I'm just wondering if perhaps we haven't learnt the lesson from not learning lessons during the pandemic. Do we not need interim conclusions? I mean, all it takes is one mutation, after all, and we're right back where we started.
There will be interim reports published after each module, and then it will be up to the government to take the recommendations of each module and action them as they say fit. Yeah, because like you said, Neil, we don't know how soon or how far away the next global health emergency is. And the one acceptance from everyone who's spoken at this inquiry so far is things didn't go as well as they could have done, and lessons do need to be learned.
My thanks to Dr Chaand Nagpaul and Ashish Joshi. This episode was produced by Soila Aparicio. Our editor was Danielle Weeks-Tulifere.